I live and pastor here in the Othello community. I'm vaccinated because I know how illness can hurt a community. As a grandfather, I am boosted to help protect my 3.5-year-old granddaughter who can't be. I don't want to see members of my community die needlessly. And as a pastor, I've had funerals for those who caught COVID, but none from taking the vaccine. If you have questions, need resources, or want to make an appointment, visit kingcounty.gov/vaccine.
Welcome to the Fitness Corner. I'm your host, Mark Bryant, and you're going to get a whole total body workout on my show, starting off with a warm-up, aerobics, strength training, cool down, and stretching every Friday from 11:30 to 12 right here on Rainier Avenue Radio.
You know you can't get enough of Rainier Avenue Radio. .world.
Welcome to Rainier Avenue Radio. This is Afternoons with Monique, recording live in Seattle, Washington, every Thursday at 1 p.m.
Good afternoon, Seattle. Can everybody hear me? Perfect. This is Monique Lee from the Afternoons with Monique show. You're on Rainier Avenue Radio, and today I have the pleasure of inviting a clinical psychologist, associate director at Children's Hospital. Youth mental health and suicide is a big problem in our country. And Dr. Alysha Thompson from Seattle Children's Hospital is on my show today to talk about this. Please welcome to my show, Dr. Thompson.
Hi, Monique. Thanks so much for having me.
Okay, now I can't hear you.
You can't hear me?
Let me just check my volume. I can barely hear you. Can you say something, Dr. Thompson?
Yep. Can you hear me now?
That is so strange. I'm going to put my headset on and see if I can hear you.
Sounds good.
All right, so I can hear you, but very faintly for some reason. How about you? Can you hear me?
Yeah, I can hear you just fine.
All right, so even though it's faint, maybe I can adjust the volume on here. Just mute. All right, if I cannot make out what you say, I'll just ask you the question and maybe have you repeat for me.
Sounds good.
So Dr. Thompson, you are a clinical director at Children's Hospital, and you've had a number of years of experience in this area. So I'm really excited to have you on the show and maybe ask some questions about your field of studies and some of the questions that I wanted to ask I have not had a chance to read about in the news. So first off, just to introduce who you are and a little bit background for our audience to get to know you. How long have you been a clinical psychologist?
Yeah, thanks for asking. I have been a clinical psychologist for the last 8 years, which is following 6 years of training as a psychologist to get a PhD. So I've really been working in the field for almost 15 years.
Oh gosh, it is hard to hear. Dang it. Why can't I hear you?
You want me to, would it help to repeat again?
I'm so sorry. I'm not sure what is going on, but I cannot make out what is being said. But I'm going to plug the headset into the computer and see if that's going to help us. Because the plug that I have is not for the iPhone. And here we go. Let's try this again. See if that will help us.
Can you hear me now?
How about now? Can we hear each other?
I can hear you. Can you hear me?
Yes.
Okay, great.
For some reason, there might be some issue with headphone or whatnot. I have to figure that out. But perfect. Okay. So you were saying about your experience and a little bit background to give the audience an idea who you are and how you came to be an expert in this field.
Yeah. Thanks for that question. So I have been working in the field for really the last 15 years, for the last 8 years as a licensed psychologist. And over that time, I've spent over 10 years working specifically in inpatient psychiatric units for children and adolescents.
Right.
So an inpatient unit is where kids go when they're having a mental health emergency, such as a suicide attempt or really severe aggressive behavior. So my area of expertise is working with youth who are experiencing the most serious mental illness at its most acute point.
Right. And I read your biography, this area that you study, and I actually have been trying to get someone on the show to talk about this because mental health is such a burgeoning issue in our country. And whenever I hear studies or news of children, adolescents, teenagers committing suicide, I grew very concerned. I have 2 teenagers at home, and this is very problematic, even if they don't have suicidal ideology in their head, but they have friends and, kids around them that deal with this issue. And we talked about it at home. So this is not just a teen issue, but it's an overall societal issue that we are facing in the United States. Am I correct?
Yeah, absolutely. This is an issue for everyone, regardless of age. And we do see youth on our unit as young as 4. And so this is something that we're concerned about for everyone. And over the last decade or so, the highest rate of rise in suicides is in that 10 to 14 age range. And so while it's a concern for everybody, it's becoming more and more of a concern specifically for adolescents.
If I may go back a little bit in time in history, because I'm a student of history, and I read a lot about different things. I think this problem, number one, is increasing with the society that we live in over the last several decades. Am I correct? It's climbing.
Yes, it is.
And youth suicide is the number 1 cause. I'm not sure what the number 2 cause of that cause death second leading cause of death in kids, teenagers. I'm not sure what the number 1 is. Do you know what that is?
I don't know off the top of my head, but I think it's like accidents and things like that.
Oh, right. So it's a big issue in this country. And I came from a third world country. I lived in Asia for the first 16 years of my life, 17 years of my life until I came here. So I have observed some trends, and I was hoping that I can ask you some question in your study. Is the United States having more incidents of suicide overall and in children?
Compared to other countries, is that what you're asking?
Yes.
I don't know those numbers off the top of my head. I know that it is an increasing concern here in our country. I think that there have been trends in other countries that they are also seeing rises in concerns around youth mental health, though I don't know that data quite as well as I know our data here, specifically in the U.S.
Okay. And this is something that I also observe is that we're busier here than other countries. We're more productive. We have a lot of great things that come from our productivity, our sciences, our technology. We're leading the world in many, many fields. But as a result of a very productive society, I felt, and please feel free to correct me if I make this incorrect observation, that the lack of involvement in parents in the home, or the lack of oversight, supervision, and interaction may be the cause for the rise, and it manifests into adulthood where the bond between the parents, or one parent or both parents with the child, continue on, and there's a void in a human being, a spiritual void that cause, and of course, this is just me, a non-PhD, non-academia like yourself speaking. These are just anecdotal and things that I read in the news and in science magazine, or perhaps a popular culture magazine. So what caused all of this issues in the United States? The lack of time, lack of connections. What is it?
I think that's a really great question, and I don't think there's an easy answer. I think it would be really nice for us to say definitively as a field, this is the reason why people are experiencing suicidal ideation and wanting to take their own life. And the reality is that we don't know. There's lots of different individualized reasons why that's happening. And I think when it comes to children, it's really easy to want to say, oh, it's because of bad parenting or something wrong with parents. And I'm hesitant to blame parents for what's going on with kids. I think parents are working really hard in general, and especially right now during the COVID-19 pandemic. And we see lots of kids on our unit who have really great parents, whose parents are trying really hard, who are both working hard outside of the home and also working hard to make connections with their kids. And what that says to me is that there's not one thing that is going to be, there's not one easy answer. There's lots of different things that I think are contributing, and each kid that we see on our unit is their own unique person, has their own unique reasons why they're experiencing suicidal ideation. And so trying to narrow it down to one thing, I think is too hard. And honestly, if we could do that as a field and then say, here's the thing we need to fix, that would actually be really great. But we don't have something that's an easy fix. And so we're trying to really think about all the different potential things that are contributing to suicidal ideation for folks. I will say that we see incredibly high rates of trauma on my unit. So kids who've experienced some sort of traumatic event that could include physical abuse, sexual abuse, emotional abuse, neglect, bullying, an accident, all sorts of things. I think that's one of the common threads that we see, is that people have experienced some sort of significant hardship or traumatic event over the course of their life. And again, those are more multifactorial. It's not just one thing that might have contributed to somebody having a hard time and having suicidal ideation. But we do know that when you've had something really hard happen in your life that has threatened you in some way, or has made something difficult for you, that leads to the likelihood that you might be more likely to have experiences of depression or post-traumatic stress or anxiety, and potentially suicidal ideation.
So I don't necessarily I feel that parents are to blame. I see a lot of great parents like you, you said, who put their heart and soul in raising their children, but the society that we live in, perhaps policymakers, there are certain things that an individual, as a media person, that I like to bring awareness so that, people who watch the show, scientists and other researchers, perhaps people hearing things, and it might click something in their head. Oh, maybe there's certain connections that haven't been looked at in the past and, identified. And of course, any issue like this has multiple routes. And I mean, I was driving on the way here, I was thinking, in other countries, there's a lack of automotives, and so my parents worked. Both of them worked, and I worked as a young teenager to help. But there is always someone around. Parents are always around the kids. Their proximity to the children, even when they work, they don't have to travel like half an hour away. They walk to work. They do everything kind of close by. If something is needed, somebody go fetch that person. So the society structure is a little bit less complex, but at the same time, it provides for children and other adults the community connections that we see declining. And so further, that avoid that I was referring to earlier, that spiritual and I maybe not quite spiritual, that's part of it, but the other part that affect our mental health. So, here, the advent of automobile, while make everything more convenient and efficient, it does interfere with our ability to connect and to meet parents, grandparents, uncle, aunts. The family unit is more spread out. So while we have more things, I have a lot of things, we all have a lot of things, but in exchange for those things, we don't have a lot of time, we don't have a lot of fulfillment. And I also look at people like famous people, wealthy people, Anthony Bourdain, Robin Williams, Miss USA 2019, Chelsea, Chris, who just committed suicide a few weeks ago. I mean, these are very successful, well-off people that should have no reason, from the average person's standpoint, to be unhappy, and yet these are happening all around us. So, as a scientist, do you have any thoughts, any offer of how this can be resolved?
Yeah, well, I think one of the first things that I want to comment on is I think sometimes there's this equation of happiness with depression as being sort of the same thing. But when we're talking about clinical depression, we're talking about a medical illness that people are experiencing. And it's not as simple as just finding more things to be happy about in your life. There are actual biochemical changes that happen in your body and your brain when you're experiencing depression. And So you listed a number of people who are really wealthy and seemingly have everything, and they're experiencing an illness. They're experiencing an illness like if they had been experiencing diabetes that can't necessarily be controlled by having more wealth or having more things or connections to people necessarily. And so I think that's something that also needs to be factored in as we think about this, is that this is a medical illness that does actually change our brain chemistry and the structure of our brain. And so it's not just as simple as, are we happy or not, right? And so thinking about like, what do we do to address this? I think we need to look at all of the things that we have in the fields of psychology and psychiatry to address these things. And as we look at somebody at the individual level, that's working on a number of different things. It can be medication management, so making sure somebody has the medication that they need to actually address those chemical changes in your body when you're experiencing depression, as an example. Engagement with a good therapist, and as you're meeting with your therapist, that can mean thinking about what are the things in your life that need to change that maybe aren't leading to you feeling happy or creating more stress, or helping you address the the things that might have happened in your life that are having a deep impact on you. And so like that combination of therapy and medication can really help us at the individual level. And then I think some of the things that you've been talking about before that are really important is to think about the differences between different sort of societal structures, right? And what I've been hearing you compare is the difference between sort of the more individualistic cultures that the United States has compared to collectivistic cultures that are seen in other countries, right? And the pretty dramatic differences in what that looks like day to day for folks. And unfortunately, when it comes to numbers in terms of rate of mental illness and suicide, I don't know that there's good evidence to show that one type of society structure is better than the other. It'd be really great to say like, oh, we just need to shift our society because they've got it figured out and they don't have as much mental illness. And that's not necessarily true. And so I think while I think you're right, being more connected to people is absolutely going to help our mental illness. I don't know that there's sort of one sort of silver bullet that's going to fix everything. Does that make sense?
No, I understand. It's hard for clinicians here unless you have lived in another country to observe firsthand or collect data from other countries to do that compare and contrast that I was referring to earlier. And although I have that anecdotally, I don't have the sampling, the significance of sampling data in order to say any conclusively that any of that, my observation is scientifically studied, empirically studied, and peer-reviewed. So these are things that, I just want to bring up, and, if people listen and it resonate with them and they study this field, maybe they can explore, because at the end of the day, I like to see certain things change, and any kind of exchange of thoughts in culture and science can be shared and better our society as a whole. But earlier you were talking about the chemical in changes in an individual. I actually read up on this and experienced depression myself during a dramatic time in my life, and have been suggested that I ought to take some medication to alleviate my adjustment, what is that? Not quite anxiety, but adjustment disorder, which is a mild kind of situation. But I, as most people who may experience that type of condition, perhaps it's a different type. But I did study up into it, and I have a thought that, chemical change in the brain and in the body is a pattern of things that started out from a very early age, and we have wiring that happened in our formative years. So these chemical changes that had been formed from birth and childhood, it become a pattern, and it can be changed by medication, chemical substance that you introduce to your body in the form of pills or other things, but it can also be manufactured by lifestyle changes naturally by our body as well. Maybe not sufficient enough to counter the negative chemical that is being. There's an imbalance of things that go on that clinician like yourself try to balance for the individual. So this is a very fascinating topic for me and others. We know that mental health is the issue this year. Everyone want to talk about that. Everyone want to have some kind of solution, hope to find something to fix the situation we're in. So, maybe 30 seconds. I think the show producer is rushing me to finish off, and I'm sorry about the early part of the show that we're not able to talk and shorten our interview today, but I'd love to have you come back. But I think I hear you. Would you be willing to come back and share more with us about what you know?
Sure, I'd be happy to.
Okay. All right. Well, thank you so much, Dr. Alysha Thompson from Children's Hospital. This is Monique from the Afternoons with Monique show. Thank you and have a great afternoon.
Thank you. You too.